We're back, everybody. Tuesday night, Rory Johnston in for Ben Hall here on Open Line on News Channel 5+. And we are live, taking your phone calls, and we appreciate you calling in and taking part as we discuss what the Tennessee Advocates for Planned Parenthood call a state of emergency for women's health. And that is based on what's been happening in the headlines recently. A lot of states taking legislative action to ban abortion outright. Missouri, on June 1st. First state in the U.S., no health center that provides abortion. Is that
right? Well, there has been a stay, and
yeah,
so
the judge, I was just going to ask, what is the status on that of what's happening in Missouri?
I think it's in court on June the 26th, I believe, and so we'll find out with the rest of the world what's going to happen there. But if that were to go through, then Missouri would be the first state without any provider.
So we talked earlier about kind of the political plan here that those pro-life groups and abortion opponents have, and that is they hope to get this before the Supreme Court. What's the timeline there that you think that it could actually go before the Supreme Court?
Yeah, I mean, that's anybody's guess. And I guess I do want to spend a little bit of time for a second, if you can indulge me, because I mentioned the 3 states that actually went to court and were found unconstitutional. Those court cases that there were state laws in Arizona, Arkansas, and North Dakota that would have banned abortion prior to viability. And I mentioned that our own Attorney General also recognized the unconstitutionality of this very bill, and yet the state legislature passed it. This year, Kentucky also passed a law banning abortions, and all of these things, I mean, all of these unconstitutional lawsuits lead to fiscal irresponsibility by the state, meaning that who foots the bill? It's going to be taxpayers that end up having to pay for these court costs. And just to illustrate, in Kentucky, as I mentioned, they're right now awaiting a ruling from a federal judge for request from Planned Parenthood and the ACLU for attorney's fees in the amount of $1.5 million. North Dakota, that other state I mentioned, they spent over $491,000 defending their 6-week ban, and they lost. Mississippi has spent $225,000 since 2012 defending laws that were ultimately struck down as unconstitutional, and it may exceed $1 million with the attempt to uphold the 15-week ban, which was recently put in place. Texas spent over $1 million to defend whole women's health, and then that went up to the Supreme Court. And the state is having to pay abortion providers $4.5 million in attorney fees. So those are all, court cases. And here in Tennessee, I want to note that Tennessee paid $1.9 million to plaintiffs in Tanco versus Haslam, defending its law banning gay marriage. And this is in addition to what it cost the state to defend the unconstitutional law. And there were far less federal court cases and no Supreme Court cases related to the laws banning gay marriage than there are setting forth the restrictions on states regulating abortion. So, again, it is not a Planned Parenthood talking point that these are unconstitutional. It is a known fact that these are unconstitutional, and we're just going to end up footing the bill.
Shabina, you are on Open Line. How are you?
Hi,
go ahead.
I was wondering, thank you so much for taking my call. I was wondering how you see these heartbeat and other restrictive abortion bills in the South affecting the coming election cycle as we look forward and kind of get ready for 2020, and what Planned Parenthood would like to see from all the Democratic candidates moving forward. We recently saw Joe Biden slip on the Hyde Amendment, and so what standards should we be holding our Democratic candidates to as we look forward as voters?
Good question. Let's real quick just talk about the Hyde Amendment. Joe Biden had supported it, but now with all of these restrictions going into place is his reasoning for saying, I can no longer support that, which basically bans federal funding. Is that right?
Yeah.
Okay.
I mean, right now, and we were saying this when there were so many efforts to, quote unquote, defund Planned Parenthood, that there are no public dollars that go to fund abortions right now at all. And what ends up happening in these defunding fights is that by our opponents, their bullseye is on Planned Parenthood, but who ends up actually getting hit are patients. And so just this past, in the 2018 legislative cycle, Medicaid patients were the ones with the targets on their backs. I don't even, and it was something that I wish had gotten out there more. But essentially what happened was the state legislature here in Tennessee decided to say, if you're a patient on Medicaid, you may not go to any provider for your birth control or family planning visits, any of those things, if that provider provides more than 50 or more abortions per year. And so, and a lot of, our patients are on Medicaid, and they come to us so that they can get birth control, the very thing that actually would prevent unintended pregnancies. So in essence, that law hurt Medicaid patients, and one could argue increase the unintended pregnancy rates. So, I think that to your question, caller, we want to see candidates that are unequivocal in being able to stand with women on their health decisions. And one caveat, I say women a lot because it's a state of emergency for women's health. And I also want to note that there are folks that don't identify themselves as women. They're trans individuals or non-binary individuals. And so I just want to
Sure.
recognize that anyone that has the ability to get pregnant, it's theirs and only their decision to be able to make.
Let's go to Kevin on line 5. Hi, Kevin. Welcome. Kevin, go ahead.
Hey, Roy, this is Kevin. How you doing?
Good. How are you?
Oh, what I would have said, Roy, I think some women, they should take care of themselves. They should be careful, Roy. And I don't know. I just think that about some women.
All right. Yeah, Kevin, thank you very much for calling. I'm sure I'll talk to you later. He's one of our regular
that's great.
callers and a great supporter of News Channel 5. We appreciate the call. Let's go to, if I got this right, and I think this is Marcus. Is that you, Marcus?
Yeah, this is Marcus.
Hey, Marcus.
I don't know how I got so delayed back at the end of the line.
Sorry.
But,
Thank you for waiting.
Well, that's all right, and I really didn't appreciate being screened the way I was, but before I got on the air. But anyway,
Okay.
My problem is that most women, seems like in the red states, are more apathetic until something directly happens to them or somebody close to them as far as abortion. And while I am a Christian and I don't morally believe that the Bible is for abortion, I would be the last one to deny a woman's right to have an abortion. I don't have a right, or any other legislator, to tell a woman what she should do with her body. God gave us free will, and especially under the circumstances of incest and sexual assault, that shouldn't even be in any, that shouldn't be even up for debate. That should be a no-brainer for the woman to have the right to choose. But we have a state legislator that right now we have a man who's made sexist and racist remarks, who's the Speaker of the House, Glenn Cassidy, and a governor who won't make him resign before his pension so he can get his pension in August, that if they don't stand up for that, if women groups will put up with what he's done, and people of color as well, the community of people of color as well, then this is just what's going to fall in line. If we continue to put up with people doing things like they do and saying it's just part of locker room talk or locker room politics, then women are going to continually to be demoralized and put back to a lower class type of status back in the 30s or 20s or whatever. And that's not realistic. And it's not acceptable. And I want to see real women in the South stand up and not let politicians think they can just get a slap on the wrist when they do things that are just not right. And that's all I have to say, and I'll listen.
Marcus, thank you. Great comments. We appreciate, again, you holding the line there for us. We do appreciate it. Hold on a second.
That was great. He hit it right on, I think.
All right, let's keep going here. So we got a lot of people on hold. Let's go to Scott. I hit the wrong line there. Scott, you there?
Yes, sir.
All right, go ahead.
Well, I had a comment and then I had a question.
Sure.
I've never been in a Planned Parenthood. I have all adult children now. But could she please maybe explain, what kind of help they give people when they come in, to their clinic? Do they have a spiritual advisor? And since they're talking about women's health, do they maybe talk about mental health down the road, like, regrets or somebody, because you have friends and family, like the other gentleman was saying, they bombard you left and right and try to make you feel bad. And this affects people's mental health as well, not just their physical health. So could she explain a little bit about that, what they offer up for young ladies who come in? Thank you.
Great. Thank you, Scott. We appreciate it.
Yeah, I mean, there's the services that we provide, which, are a lot of preventative services. In addition to what we're doing now, which is starting to go more towards primary care services, but they, we offer STI screenings and PEP and PrEP, which is a preventative prevention drug for HIV, and we offer trans care, and so there's a whole array of services that we provide. We do life-saving cancer screenings and breast exams. And so when a patient comes to us, I'll just tell you from the door all the way to seeing the physician, we have clinic greeters that are out there. And we welcome folks to come and volunteer to help create a welcoming environment for our patients that come. It helps counteract sometimes if there are
anxiety too, right?
When they come, exactly. So we have patient greeters. Folks can actually make an appointment online, or they can call. And they come in. If they're coming in for pregnancy testing, we do have options, counseling where folks can learn about their options for adoption, carrying to term, or an abortion. If they seek additional help, we have a resource guide that we can help steer them to other nonprofits that can help with those services. I think what appeals to me about what the caller said is really leading with compassion, and I think that that's something that we strive to do not only as a healthcare provider, but also on the advocacy side, helping promote that value in general, which is compassion and non-judgment, which is why a lot of folks come to our place of service, because we provide non-judgmental care regardless of why you're there. And I think we could see that a lot in the political spectrum as well, more.
It's needed.
Yeah.
TJ, you're up next. Thanks for calling.
Did you say TJ?
Yes, go ahead.
Hey there. Hope you guys are doing well tonight.
Yep.
I just wanted to make a statement. I came in midway on this, but I noticed it says state of emergency for women's health. And after hearing some of it, I'm like, it all depends on where you think life begins. But to me, it's just as much a state of emergency for babies in the womb health.
Yeah, okay. That's fair. And I was going to bring that up, too.
Thank you. I wanted to mention I have friends that had abortions because, like we'd say, not so good parenting. Back in the day, they had an abortion, and had they gone to a compassionate, like she said, non-judgmental facility that promoted life, they wouldn't have the regret that they have now. I think it's the wrong question to ask. Do we counsel people on the regret they're going to have? How about we help them to not to have to do something that causes regret?
Okay.
And people do end up in situations that are bad, but we know we have clinics like Hope Clinic. They are so compassionate, non-judgmental, and help people. And also, I was thinking, I have so many friends that have looked to adopt babies, so I know there are people there that would adopt these babies. They're always in short supply, honestly, if you want to call it that, babies for adoption. And I was going to say one other thing. I would love for funds that are spent towards some of these things to be spent toward strengthening families, so we have strong family structures so that kids naturally coming out of their organic families know about life issues.
Okay, good points indeed. And we're going to respond to those after break. We're a little late on a break here. We're going to respond to TJ's call right after this, so stay with us.